Hi, Greg Jarrett, and you were in the strategy room. There's a new report out suggesting the Hawaii Health Connector, that's the state's healthcare exchange in Obamacare, is in deep trouble. There is a plan in the works now to shut down operations by late September after lawmakers there failed to keep the exchange afloat. So is this just another problem with the rollout of the Affordable Care Act? Here now with reaction, political strategist Joe Lestingi and Ashley Intartaglia. Good to see you both. Ashley, is it a little embarrassing for the president that in his home state, the state exchange on Obamacare is going belly up?
I think it is definitely embarrassing. And look, Greg, this is just an example of when you try to take a federal program like Obamacare and shove it down everyone's throat. And in Hawaii's case, they didn't need to be saved by the federal government. They have a small population, a relatively low number of uninsured people that live there, and they already have a health care system, the Hawaii Prepaid Health Care Act, that's been in place since 1974 that seems to be working just fine. So it's no wonder that they're not getting the numbers of people to sign up. Why would anybody leave a health care system that's working to go to something that's riddled with technical problems and is more expensive?
Joe, are these just growing pains that'll eventually be worked out, or is there something fundamentally and systemically wrong with this aspect of Obamacare?
Yeah, so Hawaii's situation is very unique because what they did in their law is they failed to comply with what they needed to, the requirements covered with the integration with Medicaid programming. So the federal government said you didn't do that, so we're going to restrict the funding until you do come into compliance, and they never did. So this is actually on the legislature there in Hawaii. No other states are really having this problem. This is just specific to them. They do have a very unique program down there that requires health care coverage if an employee works more than 20 hours, something that's unique to them and not available elsewhere in the country.
Joe,
that is under attack, but no, the
program
program is still working.
I think you're wrong in just saying this is only Hawaii. Oregon already threw in the towel on theirs. It was an abysmal mess. Now you've got Vermont, which is on the verge of dumping its exchange entirely. Same thing in Minnesota, Colorado, Massachusetts. And in fact, the report in Massachusetts stated, and I'll quote, "Public officials were not only incompetent from a managerial perspective, but appear to have lied to the federal government to cover up mistakes." Joe, nearly half of the 17 state exchanges are on the precipice of going belly up.
Well, it's because each state is not doing the right reporting and they're not doing what they're supposed to be doing. States that are compliant have higher insurance rates or higher insured rates than any state that's on the federal exchange. The program's still working, though. There are 15 million Americans that did not have health care prior to 2010 that have health care today because of this program. It's working. The states have to come into compliance if they're running their own exchanges. That's a simple fix that they should be able to work out. All these administrative problems with these staffers that are not reporting well, they need to be weeded out. And the government is actually holding them accountable, which is excellent to hear.
Ashley, Joe says it's working. I suspect you disagree.
I do, and I think Hawaii is a perfect example of that. They have the lowest number of enrollees of any marketplace in existence right now. They also have the highest cost per enrollee of any place else in the marketplace. And this is just bottom line. If it's not broken, don't fix it. Let the states figure it out. Stop shoving federal programs that nobody wants down everybody's throat.
You know, Joe, after $1 trillion spent, you still have roughly the same number of uninsured out there. The latest report, 32 million Americans uninsured. Is that really worth a $1 trillion spent?
I think that we were down from somewhere in the mid-40s. So actually, I disagree with this.
$1 trillion
In fact, the
for
uninsured
8 million
rate,
people insured. Is that what you're saying? That's a good deal.
The program's been in place fully for almost a year and a half. We still have implementation still coming through. We went from 18% uninsured down to 12% in this country. That's a 6% drop after years and years of that rate climbing. So we've reversed the trends. I think we're definitely headed in the right direction. This plan's going to take some time. This is a major overhaul for the healthcare system. This plan's going to take some time to come in. We're seeing the results in the states that are compliant. More people have health coverage. Their costs are freezing and slowing down. This is good for us.
Joe Lestingi,
in the long run.
Ashley Intartaglia, good to see you both. Thanks.
Thanks for having us.
Thanks for having us.
Check out foxnews.com for more on this developing story. I'm Greg Jarrett. Thanks for watching.